The Democratic Republic of Congo is nearly half the size of the contiguous United States and is one of the world's most resource-rich countries. But a history of colonial oppression, Western exploitation, war, and corruption has left it one of the poorest and most unstable countries on the planet. It has one of the highest child mortality rates in the world. 17% of Congolese children don't live to reach their 5th birthday. Musumba Village is a community of about 5,000 people in southwest DRC. It's a few hours by bush plane from Lubumbashi, DRC's second largest city in the far south of the country. The town was once the center of a major Methodist mission that supported a hospital, seminary, schools, and churches. But when a war with nearby Angola during the 1970s brought violence to the village, foreign missionaries, as well as most locals with the means to do so, fled the area. Continuing instability and deteriorating roads meant that the area around the village grew increasingly isolated. The United Methodist Church was unable to continue its aid work in Musumba. But a few years ago, a small American delegation from the UMC returned to the village at the request of the local Methodist bishop. Although Musumba had not experienced any further violence, its water system was crumbling, its hospitals severely understaffed and under-equipped, and most of its people were surviving on the edge of starvation. Young children were the most severely impacted by malnutrition. The Americans left several months' supply of Plumpy Nut, a pre-packaged peanut-based therapeutic food, at the village hospital so that medical staff there could treat some of the hungriest children. Plumpy Nut has been called a nutritional miracle and has been used extensively by aid groups like Doctors Without Borders. It's inexpensive and highly effective at helping severely malnourished children recover. It can be easily administered by parents at home. When the American Methodists learned that several months' supply of Plumpy Nut had been used up in a matter of weeks, it was clear that more help was desperately needed. But because of the distance involved and the complications created by widespread corruption in DRC, shipping Plumpy Nut to Musumba Village on a regular basis would be extremely difficult and enormously expensive. This is where Rhodey and Alice Rowe came in. Rhodey had recently retired as a Methodist minister. He and Alice were looking for a new way to do ministry in their retirement. Working together with Kurt and Jan Kaiser, who had been among those who had originally delivered the Plumpy Nut, they conceived a plan. They would provide simple, hand-powered equipment and training so that health workers in the village could produce a generic version of Plumpy Nut locally for children in need. With the exception of the highly specialized vitamin and mineral supplements, all the ingredients used in the product could be obtained in the DRC. Producing the product where it was needed would cost less than half of what it would to purchase a packaged product. It would also provide an opportunity for local jobs and local empowerment. In 2012, Rhodey and Alice traveled to Musumba Village with a hand-powered grinder and pounds of powdered vitamins. They spent a month working with local people to get a therapeutic nutrition program up and running. They called their ministry Feed Congo Kids. The product was called Nuts for Kids. When they returned to the village in the summer of 2013 with 4 other team members, Rhodey and Alice found that the work they had started was still going strong, despite enormous obstacles. Yet the local nurses hired to administer the program had continued to identify and treat malnourished children week in and week out and record their progress. And the majority of their patients progressed significantly. Dr. Ivan Moulton, a psychologist at the University of Washington Hospital and a member of the 2013 team, is studying data from the Musumba Village Nutrition Program and hopes to compare it to data collected from other programs, such as Doctors Without Borders. Most encouraging of all, the local nurses reported that they believed they had addressed the most dire cases of malnutrition in the village, and they wanted to take the program to children in the outlying areas around Musumba. To replace the original director, a local board was assembled to handle the day-to-day administration of the existing program, as well as a new expansion to the program, which Sierra Rowe Moulton and her husband Ivan made possible.
And they are pounding together. Okay, yes.
1, 2.
Okay.
Yeah.
They are also pounding together. They have to do that. And they can have money for their children to go to school. They will sell flowers.
Soybeans were once an important crop in Musumba, but in recent decades, perhaps for economic reasons, soy cultivation has almost disappeared. Sierra and Ivan researched soy cultivation and consulted with agriculture professors at Washington State University. They worked with a seed company in South Africa to obtain a donation of several hundred pounds of ready-to-plant soybeans, which can reproduce on their own. Upon the American team's arrival, the local chief, who controls the allocation of land around the village, donated a large plot several miles outside Musumba for soybeans. If this experiment goes well, more land will be put into cultivation, helping to provide a much-needed protein source for local residents. The program also plans to donate some soy to local farmers to plant in their own plots in and around the village. These farmers will keep 70% of the harvest for themselves and donate 30% to the nutrition program, providing an important source of local support. Ivan and Sierra also obtained several hundred moringa tree seeds, and the nutrition program was given a plot near the village high school. The trees will be raised there until they are big enough to be replanted in village gardens. Moringa is a miracle tree. Its leaves are exceptionally rich in vitamins and minerals, containing many times the calcium, potassium, iron, and vitamins C and A than most superfruits and vegetables. It contains twice the protein of milk. Leaves can also be used for medicinal purposes, to reduce swelling, treat skin infections, lower blood pressure and blood sugar, and treat stomach ailments. The immature pods are full of amino acids, and the seeds can be used to remove many of the disease-causing impurities and microbes from water. The tree is fast-growing but non-invasive, needs little water, and requires no sophisticated farming techniques. There is hope that the addition of soy and moringa will raise the quality and quantity of available nutrition for villagers of all ages, and also provide important opportunities for local families to earn money by selling excess harvest. The people of Musumba, and especially the children, are imprinted on our hearts forever. We hope that in the coming years, this small, audacious nutrition program will grow and perhaps even become self-sustaining. And we hope that in the years to come, soybeans and moringa trees and children and hope will grow tall in Musumba Village. And we hope that you'll hope with us.
My name.